Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 18. We're going to talk about Bordetella and also Brucella. Welcome to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 18. We're going to talk about Bordetella and Brucella. Bordetella pertussis causes whooping cough. Extremely small, strictly aerobic, gram-negative, non-motile coccobacillus. Transmission of Bordetella is through airborne droplets and respiratory spread. It's able to establish infection by attaching to and growing on ciliated cells of the respiratory epithelium. It produces a number of exotoxins, which block diapedesis or leukocytosis, which is the human immune response to get the bacteria. This toxin is high yield for USMLE Step 1, and you'll need to know how it works. It catalyzes the addition of ADP ribose to the inhibitory subunit of G proteins. This stimulates adenylate cyclase, increases the amount of cyclic AMP, it increases mucus secretion, and interferes with many cellular functions. Adenylate cyclase toxin also catalyzes the conversion of ATP to cyclic AMP. This inhibits phagocyte and natural killer cell functions and chemotaxis. There's a tracheal cytotoxin which binds to ciliated epithelial cells and interferes with ciliary movement. The dermonecrotic or heat labile toxin is a strong vasoconstrictor. As you constrict down the blood vessels, you form ischemia and inhibit the extravasation of leukocytes. That gives you necrosis of the tracheal tissue. Bordetella pertussis has 3 stages that you'll need to be familiar with. The first is the catarrhal stage, in which you are highly infectious. You have sneezing, you have rhinorrhea, you have cough. And every time you cough, you're spreading Bordetella out to other people. The paroxysmal stage lasts 1 to 2 weeks, and it's the whooping stage. You have hypoxia, which can cause seizures and coma. You can get aspiration pneumonia, and you can get a subconjunctival hemorrhage. The convalescent stage is lasts for more than 4 weeks, and you have improving symptoms, but there's a high risk for recurrence. With Bordetella pertussis on this peripheral blood smear, you'll often see atypical lymphocytosis. Lab diagnosis of pertussis is based on a nasopharyngeal aspirate. You culture the aspirate on Bordetella medium, which is a potato glycerol blood agar, or Reagan low agar. If you don't have time to culture it, you can do PCR or direct fluorescein antibody binding. Treatment for pertussis includes erythromycin. To prevent pertussis, we give a killed whole cell vaccine, which is the DTP. The problem is there was a risk of encephalitis with the whole cell bacteria, and so we now have an acellular vaccine, which is the DTaP, the diphtheria, tetanus, and acellular pertussis, where there's no risk for encephalitis. Next, we're going to talk about gram-negative rods related to animal sources, and specifically we'll talk about Brucella. Brucella is a gram-negative, non-motile coccobacilli. It's a strictly aerobic organism, and it grows very slowly. It's a facultative intracellular pathogen, and it's the cause of undulant fever. Undulant fever is a fever that comes up and down. It's high at nighttime and low in the daytime. Transmission for Brucella is based on contact with infected animals or ingestion of their meat, which has not been purified, or their dairy products. It's more common in dairy farmers, vets, or slaughterhouse workers. Brucella melitensis is found in goats, and it's the most common form that you'll find in unpasteurized cheese. Different Brucella species are found in different animals, such as Brucella abortus, found in cows, as a common cause of cow abortion, Brucella sui, found in pigs, and Brucella canis, found in dogs. The pathogenesis for Brucella includes entering the phagolysosome. Then it releases its 5-guanosine and adenine. This inhibits the degranulation of peroxidase-containing granules, and that inhibits bacterial killing. So they live inside the endothelial system, the reticular endothelial system. They're carried to the lymph nodes, the spleen, the liver, the bone marrow, and the kidney, and wherever they want to go. There they set up chronic intracellular infection and granulomas, and a type 4 hypersensitivity reaction. Clinical findings in undulating fever include an undulating fever. It goes up and down. You've got muscle aches, arthralgias, you have a history of exposure to contaminated animal meat or their products, and you've got chronic fatigue. A lag diagnosis involves serology, or culture on blood agar. It takes 2 weeks because Brucella is so slow growing before you would consider it negative. You look for the small, white, glistening colonies, and they take 4 to 6 weeks to grow. You'll treat most of the zoonoses, including brucella, with tetracycline. You'll need 6 weeks of tetracycline plus gentamicin. Alternatively, you could use doxycycline and rifampin. If there's cardiac involvement with brucella, you'll need to add Bactrim. Let's do some questions. A 2-month-old male is brought to you with a history of a 10-day cough. Mom reports that it has worsened and now he coughs in spells lasting up to 1 minute, during which his eyes bulge and he turns blue. Additionally, he has post-tussive emesis following these episodes. CBC reveals leukocytosis with a markedly elevated lymphocyte count. The etiologic agent utilizes all of the virulence mechanisms except. So we have here a clinical scenario of pertussis. It's a Bordetella pertussis infection. We talked about a lot of the virulence factors that we use. And so we can go through them one by one. Filamentous hemagglutinin for attachment? Yes, we'll see that in Bordetella pertussis. Toxin-mediated inhibition of phagocyte function? Yes, remember we have the pertussis toxin which increases cyclic AMP. Cytotoxin which disrupts ciliated epithelial function? Yes, we also have that with Bordetella pertussis. Direct invasion of respiratory epithelial cells? No, that's not a characteristic of Bordetella pertussis. You could see it with Brucella species, but they're not going to cause pertussis. Next question. The infant in the previous question is admitted for observation with oxygen support and regular respiratory suctioning. Additionally, he should be started on. So this question is, what do you treat pertussis? Or what do you treat Bordetella pertussis with? And the answer is erythromycin. Next question. A farmer presents to you for his annual physical. He's complaining that it's been a rough spring, as all of his cows are ill and aborting their fetuses. He reports that it's taken a toll on him and he's suffering from fatigue, headaches, backaches, and decreased appetite. Which of the following would confirm that he is suffering from the same infection as his cattle? So we have an organism that you get from animals and causes aborted fetuses in cows. So you think of brucella. Also you think of brucella as causing undulating fever, which causes the backache, the fatigue, the lassitude, the decreased appetite. So looking for things for brucella and undulating fever is A. Fevers in the morning. We know that it causes fevers, but we'll have to remember that the fevers spike more at night, and it's low in the morning. It's not usually associated with a rash. C is the correct answer because you have fevers at night. Buboes you don't usually see with brucella. That's more of a bacillus infection. And pneumonia is not associated with brucella infections. So the answer is C, fevers at night for undulating fever. Wrapping up Module 18, the diseases we talked about were pertussis, and also we talked about brucellosis. Testers on Step 1 love to ask about Bordetella pertussis, from its unique culture media to its different toxins that it uses, and to the disease stage. These are topics that frequently show up on Step 1. Fortunately, we don't see much in real life anymore because of the vaccine. Brucellosis is going to be more isolated. You're going to have specific risk factors, such as a slaughterhouse worker or a veterinarian, or exposure to the infected animals. That's it for Module 18. Now we're going to go to Module 19, where we're going to talk about Pasteurella.